Hi, my name is Melissa, and I'm going to be recording my son again for his lung assessment, heart assessment, and peripheral vascular assessment. I would have him sitting upright, and I would check for an inhalation through your nose. You're a little stuffy. Go ahead and take a nice inhale in, and exhalation. And you're not having any problems breathing or anything of that nature? Okay. And I would look for the skin and make sure the coloration is good. Coloration is good. You're having good circulation. And can you just put your fingers together for me? Okay. And there's no clubbing of your fingers. I am now going to check the rate of his rhythm of his breathing and make sure he is within normal limits. He's not having any tachypnea or anything of that nature. Let me also just see your pulse. And his rate is good. I won't do it for the full minute for the sake of the video. And now I'm going to have you turn around and face the other direction, so we're going to do the back. I'm only doing the back. I'm not going to do the front and the back for the purposes of how long the video is. So anything I do posteriorly, I would do anteriorly as well. So I'm going to go ahead and palpate the back for any crepitus, any tenderness. Are you having any tenderness? I don't feel any crepitus or anything going under the skin. I don't feel any lumps or any bruising, anything of that nature that you feel. And that's good. I'm going to go ahead and have him do a vibration. So I'm going to feel that with the palms of my hands. So go ahead and say 99.
99, 99, 99, 99, 99.
Okay, everything is bilaterally. You can feel the vibrations, and it does get a little bit duller as you go down, but everything is definitely even. I need you to wrap your arms around the front of you, please. And I'm just going to go ahead and tap. Everything feels good and even. Okay, go ahead and let go. Now I'm going to do what's called diaphragmatic exercise breathing, and I'm going to be seeing what the inhalation is and what the exhalation is. The first time I have him breathe in and breathe out, I'm going to have him breathe out all the way and see where the dullness is, and I'm going to mark that point. So go ahead and breathe in for me, and breathe out all the way. Hold it for a second. Okay, and then I would just mark that area. And then I will have you breathe in, and I'll have you hold it for a second. Okay, and let it out. So you can see it's within 4 centimeters of being together, which is a completely normal limit. So that is good. All of your lungs assessments are going very well. I'm going to go ahead and auscultate throughout his different areas of his lungs and his lobes on the sides as well. I will be listening for any crackles, any rails, anything of that nature that would indicate to me that he's having difficulty breathing. So I'd start at the top. Okay, breathe in, breathe out. 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 Excellent. Go ahead and breathe in. Breathe out. Breathe in. Okay, excellent. Your lungs sound very clear. All right, now we're gonna move on to his lungs are completely fine. I'm gonna move on to the heart. So I'm gonna have you turn towards the opposite direction, please. Thank you, Benjamin. And I am going to be listening to his heart. How I would listen to his heart would go along the clavicle. I would go down to S2 and S3. I would go over to S3, intercostal space, down to 4, and down to 5. And then I would go all the way over to the apical pulse to listen for a full minute to indicate what his heart is. And that is where the S1 is, and the S2 is up by the aorta. So I will do that. Go ahead and take a listen. And you can hear the dub. It sounds very strong, and that's where the apical pulse is. And that's really good. As far as his skin coloration looks excellent. It shows that he has good perfusion. As far as any periorbital edema around his eyes, he does not have any, which would be an indication that he might be having a perfusion problem. At this point, I would have the patient lay down, but because I do not have anyone to record it, I'm just going to explain to you what I would do. I would have him lie down. I would have him look to the side. I would look for his carotid artery. I would put a light and see his carotid artery, and then I would look at his jugular vein and look at if there's any waves or forms, if there's anything going on with him that would be of concern, certainly if anything's bulging or anything of that nature, that I would need to report to the physician. I would palpate different areas of the heart just to make sure that, you know, if there was any fluid or anything going around the heart, if he had any tenderness, and certainly if you wanted to feel the apical pulse, you can even feel it right through his shirt. And that is an indication that he has a strong, healthy heart. As far as murmurs, I would look for murmurs in the aortic, pulmonic, tricuspid areas. I would start at the heart to listen, and I would go with the smaller portion of the stethoscope. And I would just listen for any abnormalities. You can just breathe normally. And I'm listening to the S2, which is the aorta. S1 and S2. And down to S3. And you're sort of in between at the S3 and then the apical pulse. And everything sounds completely normal. So that's, again, S1, S2, S3, and S4 is in the middle. And S1 would be the lub, and S2 would be the dub to listen for. And we'd also have him lay on his side and to listen to the tricuspid area and listen for any pulmonic murmurs. So with a pulmonic murmur, you would be concerned about the closing of the pulmonic valve and how it's being perfused to the lungs. And again, for the purpose of this video, I do not have anyone to record, so I'm just explaining to you what I would do. I could have him lean forward and listen to the aortic and the pulmonic areas, so I will do that as well. So I'll listen up in the right. You can just lean forward.
Okay.
Thank you. And it sounds nice and strong. And the pulmonic would be down here. And it's a nice, strong lub dub, nothing in between. I'm not hearing any abnormalities, murmurs, or concerns of the pulmonic valve. As far as the peripheral vascular, I'll move on to that. I am going to listen to the pulses of the temporal. So to make sure he's perfusing up here, just relax. And I can feel, it's important to not feel it in your own fingers, but to actually feel his pulse. I would feel for his carotid. Which bilaterally they should be about the same. Sometimes if there's abnormalities in the heart, you'll get a different feel for that, and we've found that in surgery when we need to go out and clean out the carotid arteries. I would also check in the brachial arteries, which are here, and the radial, which his is very strong. And then I would check the popliteal, which is behind his knee. And then I would check his dorsal pedial, which is all the way down his leg. The ulnar and the popliteal, which usually we have to mark those with a Doppler for people coming into surgery. And I would also look at the toes and the feet, make sure that there's hair because it shows proper perfusion of peripheral vascular circulation. And that is all. Thank you.